Hi, welcome back to my channel. My name is Patricia and I am a licensed clinical therapist. And today I wanted to talk about the difference between anxiety and depression. So I know a lot of times, people talk about depression and anxiety interchangeably, and I just kind of wanted to define, and hopefully the information that I share helps you recognize whether or not you or someone else that you might know might have depression or anxiety. And also, just a disclaimer, I appreciate you watching these videos, but these information that I'm sharing is not to replace an evaluation with a mental health provider. So please, if you think you might have anxiety or depression, I encourage you to set up an appointment with either a therapist or a psychiatrist. Okay, all right. So the difference between anxiety and depression. First, I'll start with anxiety. Anxiety typically is when you have this constant worry about the future. Something that hasn't even happened yet, but you're already just uneasy about it, you're fearful about it, you worry about it, things that haven't happened tomorrow, 5 years, 200 years from now, you're just constantly worried. That's anxiety. It's that constant fear about the future. And some of the symptoms of anxiety, it can manifest itself as sweat in your hands, or you having sometimes you shaky, or you tremors in your hands, and they can manifest itself physically. And it is also possible to have panic attacks. Now, you can have anxiety without panic attacks, or you can have a panic attack, and that doesn't necessarily mean that you have an anxiety disorder. So that's important, because sometimes you might have this one event where you had a panic attack, but that doesn't necessarily mean that you have a diagnosis of anxiety disorder. Okay, so that's anxiety. Now, depression, typically, it's not necessarily that fear about the future. You're not necessarily worried about the future. You already like there. Everything is bad. You don't feel like getting out of bed. There's no motivation. You want to isolate. You don't feel like eating. You don't feel like getting dressed up. Things that you used to enjoy, you no longer enjoy. You have no pleasure in doing things. So that's usually symptoms of depression. Just life already sucks. Like, I don't have to think about the future. It's already bad now. So that's what depression typically looks like. Now, just a different type of treatment between those two. Typically, we use, doctors use antidepressant or anxiety medicine to help, combat those. So that's usually one form of treatment. But I totally understand if you don't want to use medications, there is therapy as another option. So sometimes, depending on the severity of the anxiety or depression, you might have to use a combination of medications and therapy until we get you to a place where you have the skills and the tools to manage your depression or anxiety with just therapy. So it's not uncommon to start with medications and therapy, and then wean off the medication. So if you were to start on medication, don't worry. That doesn't mean that it's going to be permanent. But if you're really against medication, then you can start with therapy and see how that works. And if you still need additional help, then you can involve a psychiatrist to get medication. Also, just as far as therapy, just to kind of give you an idea of the form of treatment that we typically use, the modality that is most common used is cognitive behavioral therapy. And what that means is only where we really use your thought pattern, reframing your thought pattern, reframing those negative self-talk, those thoughts that are not very rational. So we really focus on reframing that. We keep record of your thoughts. You might have to use a journal, and we help you recognizing the fact, what is really a fact and what's irrational thinking. So we work on that, and we do that over and over because repetition makes it perfect. So the more you do it and your therapist is keeping you accountable, eventually you start reframing those negative thoughts. So that will be one form of treatment that will be used to help with depression, anxiety. Okay, and I just wanted to share that everything that I talked about can be found on the DSM-5. This is what we use. This is pretty much the Bible for therapists, where we use, the criteria to be able to recognize and diagnose a disorder. So, all right. So I hope this was helpful, and that you're able to gain that information. So, definitely, if you feel that you might have anxiety or disorder, I encourage you to seek the help of a mental health professional. I hope this was helpful. Thank you so much, and don't forget to subscribe. Bye-bye. See you later.